Yeah, it's overwhelming how many studies are out there, and yet I would love to see them doing more studies at the lower pressures. And I think we're going to start seeing that more and more. The doctors that I work with are starting to treat, even with the steel or acrylic chambers, they're starting to treat their patients at the lower pressures, the 1.3, even 1.1.
Oh,
And
interesting.
yeah, as soon as you are over that 1 point ATA, you're starting hyperbarics. And the response is overwhelmingly positive in a lot of cases. So I think if we just hang in there another 5 years, we're going to see a large number of studies come out.
It's a really good point you bring up because we're constantly asked that because someone comes out with on one of the health blogger sites, and then the Facebook groups go wild about it, and so then we get a bunch of phone calls. Do you have the hard chambers? And I'm like, I don't have 200 grand. Um,
Yeah.
they're kind of expensive, but also uh, they can be a little too much. Sometimes less is more. A dear friend of mine is an Egyptian neurosurgeon who was talking with me about some health issues of my own, and they wanted me to do like 15 or 20 sessions or something like that in a hard chamber. And in the miscommunication, I'm like, but I have soft chamber. He thought I was going to have to go somewhere. He's like, that no, you'll take you forever. And so it was like that kind of a conversation. He didn't want me at the much higher 1.8 or something. He wanted at like 1.5. I'm like, well, mine go up to 1.3 and I have them. And he's like, okay, do 40. I was like, okay.
Yeah,
Um,
and that's the thing I'm seeing more and more where they're taking the 1.3 chambers and they're just increasing the frequency, the
mhm,
duration, and they're achieving the same results. And, even especially if you're adding supplemental oxygen with a concentrator,
mhm.
you can, in most cases, I think, get the same results just by doing a little more. And the risk is so much reduced at 1.3
Yes.
for the user.